NREMT exam questions. Emergency medical technician practice test. 25 difficult questions. Question 1. A 48-year-old male is pale, cool, and moist, complaining of chest heaviness. Your first step is: apply AED, administer oxygen, get history, assist with neighbor's meds. Initial treatment for a symptomatic cardiac patient is oxygen administration. Question 2. The phase of a seizure characterized by a gradual state of awakening is tonic, postictal, clonic, aura. The postictal phase follows the seizure and involves recovery of consciousness. Question 3. Losing heat through direct contact with a cold object is called radiation, convection, conduction, evaporation. Conduction is heat transfer via direct physical contact. Question 4. What anatomical difference makes a child's airway more difficult than an adult's? Larger jaw, smaller teeth, longer airway, smaller jaw and relatively larger tongue. No difference. Children have smaller jaws and tongues that are large in proportion to their mouths, increasing obstruction risk. Question 5. A 75-year-old collapsed and is pulseless/apneic. You arrive 7 minutes later. Initial treatment: ventilate for 2 minutes. Immediate CPR and check for AED. Give nitro. Check for pulse for 60 seconds. Immediate high-quality CPR and defibrillation are the priorities for cardiac arrest. Question 6. Which sign is indicative of hypoperfusion, shock, high blood pressure, warm, dry skin, altered mental status and tachycardia, slow heart rate? Tachycardia and altered mental status are early signs of shock. Question 7. Pursed lip breathing in COPD patients serves what purpose? Exhale faster. Provide back pressure to keep alveoli open. Increase oxygen intake. Reduce heart rate. Pursed lip breathing creates PEEP, positive end expiratory pressure, to prevent alveolar collapse. Question 8. A patient has black, tarry stools and vomits coffee grounds. This indicates lower GI bleed, upper GI bleed, bowel obstruction, gastroenteritis. Melena, tarry stool, and coffee ground emesis are classic signs of an upper GI bleed. Question 9. Referred pain from cardiac chest pain is commonly felt in the right leg, left arm and jaw, abdomen, lower back. Cardiac pain often radiates to the left arm, jaw, and shoulder. Question 10. What is the most significant advantage of the two-person BVM method? Better seal and ventilation volume, faster rate, reduced fatigue. It is easier to do alone. 2 people can ensure a better mask seal, C-clamp, and more consistent tidal volume. Question 11. Which of the following is a late sign of shock? Tachycardia, anxiety, hypotension, pale skin. Hypotension is a late, decompensated, sign of shock. Question 12. A 19-year-old is breathing 4 times per minute after an overdose. You should apply nasal cannula, apply non-rebreather, perform BVM ventilation, wait for ALS. A respiratory rate of 4 is inadequate for life. The patient requires assisted ventilation. Question 13. The golden period in trauma refers to the time it takes for the ambulance to arrive, the time from injury to definitive surgical care, the first 15 minutes of an assessment, the time after the surgery. The golden period emphasizes that trauma patients need surgery as soon as possible, ideally within an hour. Question 14. A patient has a tearing pain in the back and unequal pulses. You suspect myocardial infarction, aortic aneurysm/dissection, pulmonary embolism, pneumothorax. Tearing back pain and pulse deficits are hallmarks of an aortic dissection. Question 15. Standard treatment for an open chest wound, sucking chest wound, is no dressing, occlusive dressing taped on 3 sides, pressure bandage, tourniquet. An occlusive dressing taped on 3 sides acts as a one-way valve. Question 16. Which condition is characterized by a silent chest in a severe asthma attack, impending respiratory failure, successful recovery, hyperventilation, pneumonia? A silent chest means no air movement, which is a life-threatening emergency. Question 17. The rule of nines for an adult's entire right leg is 9%, 18%, 4.5%, 36%. Each leg in an adult is 18%, 9% front, 9% back. Question 18. A patient is in status epilepticus if they have 1 seizure, they have back-to-back seizures without regaining consciousness, they have an aura, they feel tired after a seizure. Status epilepticus is a medical emergency where seizures are prolonged or repetitive. Question 19. Where should you check a pulse on an unresponsive infant? Radial, carotid, brachial, femoral. The brachial pulse is the standard for infants. Question 20. Cushing's triad, high BP, low HR, irregular respirations, indicates dehydrated shock, increased intracranial pressure, heart attack, anaphylaxis. Cushing's triad is a classic sign of late-stage rising ICP.